Great. Thank you all so much for this opportunity to present our work on telomere length and neurodevelopment among children exposed and unexposed to HIV. I have nothing to disclose. So telomere length is an important biomarker of biological age. Yesterday, we got to hear a bit about telomeres, and they're the caps on the end of the chromosome that shorten over time as our cells replicate. They also shorten with inflammation and oxidative stress. So telomere length is important because it's been associated with so many health outcomes. When we look at telomere length over the life course, we interestingly see the first 2 to 3 years of life, there's this higher rate of attrition in telomere length. Recent evidence shows that some studies have found an association between neurodevelopment and telomere length. These studies have different neurodevelopmental assessments that are used in different time points. In the orange of this figure, you can see findings where longer telomere length was associated with better or higher neurodevelopmental scores. And in blue, you can see findings where there was no association between telomere length and neurodevelopment. There's one study that's been done among children who are HIV exposed and uninfected, or CHEU, and the findings are highlighted here. And 4 studies evaluated early telomere length and later neurodevelopmental outcomes. We want to look at CHEU because there's reason to think they could have shorter telomere length compared to CHUU. There's evidence that they could have high rates of inflammation, oxidative stress, and immune activation compared to children who are HIV unexposed and uninfected. And CHU may have lower neurodevelopmental scores compared to CHUU across domains. Using data from the HOPE study, which enrolled 1,000 CHEU and 1,000 CHUU, we measured telomere length for 250 CHEU and CHUU. Participants were enrolled from 7 maternal and child health clinics in Nairobi and Western Kenya. And telomere length was measured at 6 weeks. Survey and neurodevelopmental data were measured at 6 weeks and every 6 months thereafter. CHEU and CHUU had similar age, sex, birth weight, and preterm birth. CHEU more frequently breastfed at 6 weeks, had older parents, had mothers with fewer years of education, and were more likely to live in a household with moderate to severe food insecurity. As presented at CROI in 2025, telomere length was similar between CHEU and CHUU in the HOPE study. Overall, we found that child's 6-week telomere length was not associated with poorer neurodevelopmental scores. Contrary to our hypothesis, there was one finding that was longer telomere length was associated with lower social scores at 12 months. When we looked among subgroups of CHU and CHUU, this association went away. So there was no association between neurodevelopment and telomere length. In this relatively large cohort, shorter 6-week telomere length was not significantly associated with lower neurodevelopmental scores through 2 years of follow-up. We're really excited to look at other exposures, including telomere length decline between 6 weeks and 24 months due to that curve that I showed earlier on. And here's just to contextualize our findings with current findings that are out there. Thank you all so much. I want to thank our HOPE study participants, my mentors and collaborators, and our funders. Thank you.